Welcome to the 8th and final day of the Division of Workers' Compensation Healthcare Provider Spring Boot Camp Series. You made it to the end of this obstacle course. The recovery tent. Today we're going to offer you some shade where you can relax, reflect on your hard work, and make sure that you get rewarded for successfully navigating this workers' compensation journey. We want you to get paid for your hard work and to be paid correctly and timely, so it is important that you learn to recognize current billing requirements, identify reimbursement values, as well as apply these billing instructions to whichever doctor role you are filling. This presentation is for your education, but the responsibility of following our laws, the Texas Insurance Code, the Texas Labor Code, and our rules, the Texas Administrative Code, is yours. If there's ever a discrepancy or a dispute about what is presented today, it's going to be resolved based on the language in the rules and the statutes. So today we're going to be going over the rules and billing requirements for designated doctors and other certifying doctors. And then we'll go through billing instructions and examples of bills for each type of doctor, including designated doctors, required medical exam doctors, treating doctors, and referred doctors who do maximum medical improvement and impairment rating exams. And last, we're going to go over some helpful resources to help you as you move forward. So you can find the Texas Administrative Code, our rules, on the Texas Department of Insurance Workers' Compensation website. So please refer to the Navigating DWC Resources document that you received attached to your login instructions email for this webinar. That's going to have some direct links to our rules. The first section of important rules is going to be Chapter 133. It's a good idea to have your billing staff become familiar with Chapter 133 because it outlines all of your general medical provisions, time frames, how to fill out your bills, and what the insurance carrier does once they receive your bill. 133.10 is about filling out your billing forms. 133.20 identifies time frames for bill submission. 133.200 guides what the insurance carrier does when they receive your bill. And if you're billing electronically, 133.502 is going to note the requirements for doing so. Next, 134.210 is going to outline that our fees are going to be adjusted annually by applying the MEI adjustment factor. MEI stands for Medicare Economic Index. And that's going to have all of your modifiers also for workers' compensation specific services that you'll need to include. So next, each doctor role is going to have their own rules for maximum medical improvement and impairment rating examinations, or Rule 134.235 is the rule for RMEs, required medical exams. 134.239 guides how you'll bill for work status reports provided in your exams. And then you have your designated doctor, treating doctor, and referred doctor rules in 134.250 and 134.260. Referred doctors are when treating doctors might need to send patients out if they're in need of an MMI and impairment rating exam, and they're not certified to conduct that type of exam. So they would be using a referred doctor. And as you can see from this slide, each type of doctor has their own rules. And we're going to be breaking this presentation down by each type of billing today. And continuing, we have some general informations and definitions that are going to apply to all of our doctor roles. First, you'll hear us saying authorized and certifying doctors interchangeably. Certified doctors are going to be those who are able to conduct impairment ratings, with one slight exception for out-of-state doctors. And these terms come from Rule 130.1. certification of maximum medical improvement, and evaluation of permanent impairment, along with Rule 180.23, division required training. So if a doctor is certified to assign impairment ratings, this will be reflected on their tax comp profile. And if the doctor is certified to conduct impairment ratings, then that means that they have met this criteria listed on the slide. So they have completed the required DWC training. They have passed the required test at least once since May of 2013, or as requested by the division. So let's go through each of the doctor roles that we will see examples for today. First, the treating doctor. This doctor is primarily responsible for the efficient management of healthcare and coordinating the healthcare for the injured employee's compensable injury. Compensable means payable injury. They may not be fully certified to conduct impairment ratings, but they may be they may be able to certify that the injured employee has reached maximum medical improvement. So treating doctors may refer out to a certified doctor for MMI and IR evaluations. Again, that's the referred doctors we talked about earlier. If the treating doctor thinks that the injured employee might have permanent impairment as a result of the injury, then they might need to find one of those referred doctors. And our tax comp system, again, has information about healthcare providers, including whether or not they are certified to do these types of exams. So treating doctors may find these doctors on the tax comp system. Designated doctors are our specially trained doctors. They are selected by the division to resolve questions about disputes about an injured employee's medical condition, the work-related injury or illness. And designated doctors can order testing from other healthcare providers to resolve these questions. And both designated doctors and RME, required medical exam doctors, are ordered by the division, but there's some major differences. That designated doctor reports is the biggest, and that's that designated doctor report has what's called presumptive weight. And what that means is the results of the designated doctor exam findings is going to hold more significance if there was a dispute and there were more opinions from other doctors. The RME doctor is basically the insurance carrier doctor who is authorized and able to conduct impairment ratings, who examines the injured employee in response from a request by the insurance carrier or the division. And RME doctors may also be asked for their opinion about the appropriateness of the injured employee's health care, but most often the requests are going to follow a designated doctor exam. So now we're going to look at reimbursement for each doctor type, and here's some rule references for each. Something I want to talk about first, in 2024, some billing and reimbursement rules were repealed and replaced, and the new fees are for dates of service on or after June 1st, 2024. The rule changes were made to increase your reimbursement and to simplify the billing. So when the 2024 rule package passed, there was a one-time catch-up since fees had not been updated in a very long time. So fees were increased by taking the MEI, that Medicare Economic Index, and applying it to the period of 2009 to 2024. After 2024, fees will be adjusted based on the MEI every year in January. So those fees are no longer going to be static. The MEI is determined by the Centers for Medicare and Medicaid Services, and that's based on the price of goods and services needed for you to operate your business. So as you'll see in the note, if you look at the rule text, 2024 amounts are going to be listed in the rule text. But again, remember, they may change. So we'll give you a resource to look at to find the current amounts on our on the division website. So this is a picture of the exam fee table. It's going to be on the conversion factor page on the Division of Workers' Compensation website. And this was previously there, but it's been replaced with a more thorough one. And every DWC specific fee has been included. We published this information currently listing all the fees with a few previous years archived in the other columns. So this table on the medical fee guideline page of, again, at the division's website is just updated to include all of the fees for workers' compensation specific services, and we're going to update this annually. The oldest column will fall off, so you'll always be able to come back here and find those current fees. So something in the rule that applies to your fees is rounding, and anything under 50 cents is going to be rounded down to the nearest dollar. Anything over 50 cents is rounded up. And it is important to note that one exception is for treating doctors. Rounding does not apply to treating doctor MMI fees. So all the others it does apply, just treating doctor MMI fees, it does not. And those are paid from Rule 134-203 or your contract. If you're part of a certified healthcare network, we're going to see an example of this later, but just know if you're a treating doctor doing a maximum medical improvement only exam for billing, MMI, and impairment rating, rounding doesn't apply. So this is very important, found in section 134-210E. This section is found in our medical fee guideline for workers' compensation specific services. Doctors, when you're billing for MMI and impairment rating or other similar examinations, you must bill the MAR and be reimbursed the MAR. So doctors, you have to bill the MAR. Insurance carriers, you have to pay the MAR. That means no discounts, network discounts to RME doctors, referred doctors, treating doctors, or designated doctors, except when it's a treating doctor for MMI exam only, and then network discounts may apply. So let's take a look first if the doctor has determined that maximum medical improvement has been reached for an injured employee, but there's no possibility of permanent impairment because the injury is sufficiently minor. Usually this would be handled by the treating doctor, wouldn't normally raise to the level of a designated doctor, but only the maximum medical impairment part of the exam would be billed in this case if there was no impairment. And we're going to keep in mind as we go along that 0% impairment is a different concept than no impairment. A 0% impairment rating would require the doctor to be certified. An exam with no impairment is the type of exam that will be addressed by our new telemedicine rule that was recently adopted and is going to become effective June 1st. We are going to have training coming up on this, so please subscribe to the division announcements and keep an eye out for that. So when a certifying doctor finds that the injured employee has reached the point of maximum medical improvement and there is the possibility of permanent impairment, you're going to bill for both the MMI portion and the impairment rating portion of the exam because it was conducted by a certified doctor, regardless of whether you use range of motion or diagnosis related estimate DRE method for that billing. That was one of the changes that was made in 2024. So if you've been in the system a while, you know that caused some confusion in the past. So we did update that in 2024. And also we talked about no impairment in this example. Even a 0% impairment rating would require the doctor to be certified, and they would bill that impairment rating portion of the exam. The MAR for maximum medical improvement examinations and impairment rating examinations is equal to reimbursement for the MMI part and the impairment rating part. So that's going to be your MAR. Your total MAR for MMI and impairment rating examinations includes the following components. It's going to include your examination of the injured employee, a consultation with the injured employee, reviews of the records and films. So you spend time on these and your reimbursement should be reflective of that. Other components are going to include included in the MMI and IR fees are the preparation and submission of reports. And this includes the DWC Form 69, which is the report of medical evaluation, and DWC Form 68, the designated doctor exam data report. So these forms have not changed. It includes calculation of tables, figures, and worksheets, narrative reports, tests conducted that are outlined in the AMA guidelines required for the exam. And if the AMA guides say you need to do it as part of the impairment evaluation, it's included in the MAR. And keep in mind, we're currently using the 4th edition of the AMA guidelines for these exams. So if it's included in the AMA guide, it's included as part of that exam. So let's talk about musculoskeletal body areas for impairment rating examinations. MSK is going to be short for musculoskeletal body areas. The certifying doctor may bill a maximum of 3 MSK body areas. The spine and pelvis is 1. The upper extremity and hands are another. And lower extremities, including the feet, is the other. So again, for a maximum of 3 MSK body areas. For non-MSK body areas, those are impairment ratings where it's not musculoskeletal, but other types of body systems, body structures, including the skin, mental and behavioral disorders, and spinal injuries. So for non-MSK body areas, those are impairment ratings where it's not musculoskeletal, but other body systems and body structures, including the skin and mental and behavioral disorders. You'll be billing for each of those, and a complete list can be found in the AMA guides. There are chapters within these body system structures and mental and behavioral disorders, so if it's listed in those chapters, you can bill it as a non-MSK body area. So refer to the appropriate AMA guides, currently the 4th edition, so that you can bill accurately for your work. So we've been talking about changes to a number of rules, but the billing for the DWC Form 73 work status report is going to be the same. If you're conducting an exam that was ordered by the DWC, such as a designated doctor or RME exam, you would not bill separately for this form. So written into Rule 134.2 are incentive payments for workers' compensation underserved areas. The rule has a list of zip codes where the carrier is expected to add an additional 10% to the MAR if the doctor is conducting the exam in that area. So providers, you are not adding this onto your bill. The reimbursement is added by the carrier on the back end. And something important, if the doctor has a missed appointment, the designated doctor has a missed appointment in one of these areas, then they will not get that extra 10% in this case. And we're going to get into that missed appointment fee here in just a little bit, but just giving you a heads up, that's one exception to this. So let's start looking at examples for each doctor role. We're going to start by putting on our designated doctor hat and just keep focused on the designated doctor role in these billing and reimbursement examples that are, and that billing is going to be outlined in Rule 134 240. So as a reminder, effective dates for designated doctor medical bills, you need to make sure that you're doing what is required for division-ordered exams on or after June 1st of 2024. That's the effective date for these revised rules. So if you're a doctor performing additional testing or evaluation for a DD exam, that would be for exams ordered on or after June 1st, 2024. These new billing changes apply. So our designated doctor exams include maximum medical improvement, extent of injury, disability, return to work, and other similar issues. And this outlines the law that tells us how to order designated doctor exams. It describes their role in assisting to resolve disputes. Designated doctor and these bills must contain the DWC assignment number in the pre-authorization field. That's part is in this rule, and we're going to get into that right now. So one of the new important new aspects of the designated doctor bills after June 1st of 2024 is that they must include this assignment number in the pre-authorization field. And this slide is a screenshot of what the letter, the OA 32 letter, you might call it the order for the designated doctor exam, looks like. And this assignment number is going to be listed in the right-hand column, kind of towards the bottom. So although it goes in the pre-authorization field, keep in mind it is not a pre-authorization number, because the designated doctor exams, related testing, evaluations do not require pre-authorization. So the number is going to be 12 digits, and keep in mind that you need to give this number to any healthcare provider, designated doctor, any healthcare provider that you send the injured employee to for testing or evaluation related to that designated doctor exam. They're going to need this number too. So the format of the assignment number includes the DWC claim number. It's going to be the first 8 digits, and then the letters DD. It's going to indicate that it's a designated doctor exam, and then the next 2 digits are the sequence number. So you have your DWC number plus DD plus the sequence number, indicating whether this is the first, second, third designated doctor exam, and so on. Sometimes these injured employees do have repeated designated doctor exams, so we'll assign those a sequence number. And something else to keep in mind, the DWC number is not the insurance carrier claim number. Those are different. The DWC, we have our own numbering system to track and categorize these claims. So just keep that in mind. The DWC number is not the insurance carrier claim number. So the assignment number must be listed in the prior authorization field. It's going to be box 23 on the CMS 1500 for designated doctor exam bills and any DD ordered testing or evaluation medical bills. Box 63 for the UB04. Maybe the injured employee was sent out for an MRI, and you need to make sure that the facility has the assignment number for that DD exam so that they can put it in that field 63. That's the box for treatment authorization codes. It's going to go into field 30 on the DWC 66, which highly unlikely. We don't see these forms very much. And then box 2 on the dental form. If a carrier receives a designated doctor bill without the assignment number, carriers, listen up. You need to follow Rule 133-200, which says that you should either fill in the blank for the healthcare provider, so fill in the blank where that authorization number should be, or return the bill as incomplete. So providers, we want the number to be in there so that you don't run into this or have any problems with your bill. So keep in mind that DWC assignment number is very important, needs to be on your bill. So here's a screenshot of the OA 32 order, but this is the second page at the bottom. This is going to show you the insurance carrier contact information, and this is also good information for any doctors that you refer out to for additional testing for that DD exam. Please help them get their bills right by passing along this information. This information also includes the DD assignment number. You can find it there at the bottom on the left at the top. So this billing deadline applies to all of our healthcare providers, including designated doctors. You must submit your bill within 95 days or no later than 95 days after the date of the exam. So this applies if no additional testing was done after the DD exam. You still have that 95 days. But when additional testing or evaluation is done on the same day, again, 95 days. If you've been in the system a while, you might recognize some of these modifiers. These were deleted because they caused confusion. Some of them were hardly used. So these should not be used. Do not use these after June 1st, 2024. And if you have one of these on your bill, it may be denied. And if it went to medical fee dispute resolution and the carrier raises this as a defense that you had one of these deleted modifiers on your bill, you're not going to win. So remember, do not use these after June 1st, 2024. So here are our current modifiers that apply. So NM is going to be used to indicate that the injured employee is not at MMI, and it can be used by any doctor, by any of our doctor roles. V3 through V5 are for treating doctors only, and this is going to indicate the evaluation and management level that corresponds to the impairment rating. So the VR is for treating doctors. That stands for view report, where you agree or disagree with the findings on a DWC Form 69 from a different doctor's certification. So I said before, we're putting on our designated doctor hat, but a few of these are going to apply to treating doctors only of these current modifiers. But these are our current DD only modifiers. So we have W5. That's going to be for your MMI IR. W6 is going to be for extent of injury questions. For instance, if a designated doctor was asked to do extent of injury, they're going to use W6. W7 is for disability exams, W8 for return to work examinations, and W9 for other similar issues. So again, these W modifiers are for designated doctors only. RME doctors do not use these. Treating doctors do not use these. MI is for multiple impairment ratings, and that's going to be when designated doctors have been asked by the division to do multiple impairments. So this request will come from the DWC on something called a presiding officer's directive, or a POD. It looks similar to the DWC Form 32 that you might be used to, but these come from a hearing officer at the division. So do not do multiple impairment ratings, designated doctors, unless you are asked to do them by the division on that order, that POD. So then you're going to add that MI modifier to the bill to get reimbursed for your extra work. And here are a couple of other the newer modifiers for designated doctors. So 25 would be added to your bill when you're asked to do an examination of an injured employee that has one or more of the complex diagnoses that are listed in 127, 130. For instance, a vascular injury, traumatic brain injury, infectious disease, spinal injury, etc. So 25 is your modifier to get that extra $300. And let's see. You might already be familiar with 25 modifier outside of workers' compensation. However, when using this in workers' compensation billing, just remember that the rules are different. So you need to shift your approach. Keep that tunnel vision right now. You're in workers' compensation, so your approach needs to fit those workers' compensation guidelines. Modifier 52 is going to be for missed appointments for the designated doctor. And that means that you went to the exam site, you waited at least 30 minutes after the scheduled appointment time, and make sure to document that you stayed at the exam location for 30 minutes or more, and that's going to support your charge for that missed appointment. And again, these are for designated doctors only. So designated doctors may conduct MMI exams, impairment rating exams, extent of injury, disability, whether or not the injured employee is able to return to work, and other similar issues to help resolve those disputes. So first we're going to look at a situation that's not too likely, where the designated doctor finds that the injured employee has not reached MMI. So usually this wouldn't rise to the level of a designated doctor. But you would bill using 99456 with that NM modifier, not an MMI, and the reimbursement amount would be $465, and that's what you would bill for the MAR, $465. You would get paid $465, and as we discussed earlier, if it's one of those underserved areas of the state, the carrier is going to add that extra 10% reimbursement. So you'll see the asterisk next to that $465. Just keep in mind, it has that asterisk because that amount can change based on the MEI, that Medicare Economic Index. It's going to be adjusted every year. So this slide is going to show you whenever a designated doctor examines the injured employee who has reached MMI, but they have no possibility of impairment. So 99456 is going to be our CPT code with that W5 modifier, and $465 is going to be the MAR for that MMI exam. So it looks the same as the previous example because the designated doctor did not conduct an impairment rating exam, so none is billed. There was no possibility of permanent impairment. This is when a designated doctor examines someone that is at MMI, has an impairment rating calculated. They're going to bill 99456 with a W5 modifier, and the reimbursement for the MMI portion is going to be $465, and also they're going to bill that impairment rating portion. Even if that calculation is zero, it is still a calculation and different from no impairment, no possible impairment. And this is how it works. If it's a musculoskeletal body area, you're going to bill 99456 with a W5 modifier. Your units are going to reflect the number of MSK body areas. And remember that there's a maximum of 3 MSK body areas. But if it's for one, the first one is going to be reimbursed at $398. Again, current values. And each additional MSK area is reimbursed at $199. So again, these amounts may change based on that MEI going forward. If your doctor calculates a non-MSK body area using the AMA guidelines, the chapters for those non-MSK areas. Important to refer back to those chapters. Reimbursement for 99456 with modifier W5 would be $199, and there's no limit on the non-MSK body areas. However, following the AMA guidelines for the chapters on non-MSK when determining the body areas, always follow those chapters. So for those tests that are outlined in the AMA guides, those are going to be included in those previous reimbursement amounts. For tests that the designated doctor may conduct themselves that are not outlined by the AMA guides, they would bill using the appropriate CPT codes for that test, and they'll be reimbursed according to the DWC fee guidelines, in addition to the MMI and impairment rating amounts. So this outlines when a designated doctor sends an injured employee out for testing. Rule 127.10 says that the designated doctor must refer out for additional testing or evaluation when it's necessary to resolve the issue in question. So this is an instance of when the DD must provide the assignment number found on that OA 32 letter that we looked at. They need to provide that to the testing healthcare provider. And pre-authorization from the insurance carrier is not required for the bill for the designated doctor or any ordered testing or evaluation related to that exam. So pre-authorization is waived, it's protected. The insurance carrier may not deny the designated doctor ordered testing or evaluations for a lack of medical necessity, extent of injury, or compensability. However, if you're the testing healthcare provider, you need to bill using those proper codes and billing. And the carrier can, if you're the testing healthcare provider, you need to bill using the proper billing and codes. The carrier can still review the bill for that type of information, like correct coding, initiative edits, and choosing the proper CPT codes and documentation supporting your choice of CPT codes. So also something to keep in mind, designated doctors cannot be in the same network that covers the injured employee's claim. But designated doctors can make referrals to other testing healthcare providers regardless of their network affiliation. So designated doctor cannot be in the same network, but if they can refer out to other providers that may be. So designated doctor, you're going to make your best referral out to somebody that's going to conduct that testing for you and get you the information or data that you need. And these healthcare providers can use the resource document found on our website. It was also attached to your login instructions email for this webinar. So send that document to the testing healthcare provider along with the assignment number. They must bill using the proper CPT codes, have that assignment number in the pre-authorization field, and attach their required documentation. So remember, reimbursement is going to be according to the applicable Division of Workers' Compensation fee guidelines. And if it happens to be a provider in the injured employees network, then of course they're going to get the network, their contracted amount. So here's an example of the CMS 1500. This is the testing doctor, or say it's a hospital or some other type of physical therapy clinic. This is what it would look like in the middle portion of their CMS 1500 field. In the middle of their CMS 1500. And field 19 is a free text field where they can identify that this is a designated doctor referral. That's an optional field, but really it's the assignment number that's going to alert the insurance carrier that this bill is related to a designated doctor exam. And the assignment number goes in box 23. So let's take a look at other types of exam bills besides MMI and IR. The extent of injury exam is when a designated doctor has been asked to give their opinion on the extent of the compensable or payable injury. They should bill 99456 W6 modifier and get $664. And that amount is subject to change, of course, based on that MEI. If the designated doctor conducts a disability examination, it's going to be 99456 W7, and a disability examination has a MAR of $664.
And work status reports are usually billed at 99080-73, but it is not billed separately here. It is part of that return to work exam. So for return to work exams, designated doctors and RMEs do not bill your work status report separately. And $664 is the reimbursement amount. And of course, it's subject to change due to changes with the Medicare Economic Index. So if the issue in dispute is not covered in those first three examples, it could be other similar issues that the designated doctor has been asked to give their opinion on. And for those issues, they would bill 99456 with a W9 modifier, and reimbursement for that is currently at $664.
Now let's talk about certain diagnoses related to Rule 127-130. On the DWC 32, you'll see that more complex condition is going to be checked. So on the request for the DD exam, you may have some of those complex conditions checked, and a designated doctor needs to meet certain qualifications to even take that sort of exam for those complex diagnoses that they've been assigned. So in this case, no matter what the outcome of the MMI and the impairment rating, you still get that additional $311 current value. And you'll bill that with a 99456 and a 25 modifier with reimbursement of $311. So this is a one-time fee, no matter how many of those special conditions you're addressing on that same day. It's a one-time fee on top of everything else for those complex diagnoses. And if you want to see a list of those diagnoses, look in Rule 127.130. So if the division asks the designated doctor to complete multiple impairments on one of those special orders called a presiding officer's directive or a POD, they're going to bill for 99456 with W5 modifier as well as that MI modifier. So the number of units, again, it's just going to be the number of body areas rated, and reimbursement for each additional impairment rating calculation is going to be $66. And again, that's subject to increase based on the MEI. And remember, this is for designated doctors only, not for RME doctors or treating doctors or referred doctors. DDs only. And the missed appointment fee is also for designated doctors only. And this is when the injured employee does not attend a properly scheduled or rescheduled examination, and the designated doctor has to wait. They need to wait at least 30 minutes at that location after the appointment time, and you need to document that you did wait and that the exam was properly scheduled. And if you need to refer back to what a properly scheduled exam means, you'll find that in Rule 127.5. So DDs must bill for the missed appointment fee with 99456, modifier 52. The missed appointment reimbursements at reimbursement fee is $104. And again, that's subject to go up over time based on the MEI. And something else to keep in mind is you'll need to add a diagnosis code to the missed appointment fee bill. And when you're looking for that, maybe you've never seen this injured employee before, but you should be able to find a diagnosis code in the records that you've received for that exam. And we've actually been seeing some medical fee disputes come in on this very issue. So Always look for that diagnosis code. So designated doctors must bill for that missed appointment fee with 99456, the 52 modifier. And again, reimbursement is at $104 currently. And this is not going to qualify for that underserved areas incentive pay of 10%. So even if you're going to traveling to an underserved area, one of those remote areas of Texas, you're not going to get that 10% added. So just keep that in mind. So let's look at some specific examples.
Billing example number 1. This designated doctor examined the injured employee that had a lumbar strain sprain for several disputed issues: maximum medical improvement, impairment rating, extent of injury, and return to work. So there were lots of questions about this injured employee. The designated doctor uses the range of motion method to evaluate that one body area. So maximum medical improvement is going to be billed at 99456, modifier W5, with $465 fee. The impairment rating is 1 unit because it was just the one body area. So that it's going to have a W5 modifier. $398 is going to be the fee. Extent of injury, 99456. W6 modifier, $664 fee. And return to work, 99456. W8 modifier at $664 fee. So the total on this bill is going to be $2,191. And note that 2025 is at the top. Again, just to alert you that all of the fees that you see are subject to change over the years based on the MEI. So if you're looking at this in the future, again, these are the 2025 fees. Something else, in these examples, I took the liberty to itemize each line item so that you can see each of the fees for each individual charge. If you want to collapse it into one billing line for the whole exam, the rule doesn't say whether you need to separate them out or bundle them together. If the carrier, if you submit it one way and the carrier asks for it differently, then you may want to do that. However, the insurance company advises, if you can do it within that 95 days. But on the front end, best practices are to bill on separate lines. That way it'll be itemized, and it may help you if issues or disputes arise with your bill and you need to go to dispute resolution or handle any of those issues with your bill. And remember, you have 95 days to submit it. So we've actually had some disputes go through medical fee dispute resolution on this very issue. And this is going to go for all of the examples that we'll look at today. We're going to have them itemized out.
Example number 2, this injured employee has lumbar as well as a foot and leg injury for maximum medical improvement, extent of injury. And the designated doctor uses the DRE method. And again, doesn't matter if they use range of motion or DRE, it's not going to impact the billing. So they use the DRE method to evaluate the impairment rating and completed a second impairment rating calculation at the request of the division. So remember, the division has to request that second calculation on a pod to get reimbursed for it. So MMI is going to be billed at 99456, modifier W5, $465 reimbursement. The impairment rating, you have 2 body areas here. So we have the spine and the lower extremity. So you're going to have a unit of 2. And that first body area billed at $398, the second one at $199. And the second impairment rating calculation, you're going to bill with that W5 modifier and MI modifier, and you would get $66. And the extent of injury examination billed at $664, and the total bill equals $1,792. And again, 2025 rates in this example. So this is an example of how it would look if you did not order testing, or maybe the testing was done on the same day. This is how it would look on your CMS 1500. So you're going to have the date of your exam in the to and the from sections because it was all done on the same day. So January 8th is when the exam occurred. The to section is the same date. Everything happened on that day, and you have 95 days from that day to get the bill in. So the next example is an injured employee with a lumbar strain and a lower leg injury for maximum medical improvement, impairment rating, extent of injury, and return to work. The designated doctor uses the DRE method to evaluate the spine and range of motion for the lower leg. So two different ways to evaluate impairment, but the billing is going to stay the same. Doesn't matter. Maximum medical improvement, going to use 99456 CPT code. W5 is the modifier. For the MMI evaluation, $465 is the fee. For the impairment rating, there are two body areas regardless of how they got that impairment rating. $398 for the first area, $199 for the second, which equals $597. And then two body areas at the are going to go into the units, and extent of injury in the return to work. We're going to use the W6 modifier and the W8 modifier respectively. So $664 a piece. We're going to have a total of $2,390 for this billing example. So in the example where your designated doctor sends your patient out for additional testing, the from and the to dates are going to matter, because the to date is going to be the date of the last test the designated doctor ordered was completed. So the designated doctor refers out for a test, the test is completed, the to date is going to be that day. So this is what it looks like where the injured employee was sent out for testing. So they examined the injured employee with the spinal cord injury for maximum medical improvement, impairment rating, extent of injury, and return to work. And the exam took place on January 15th of 2025. The designated doctor uses the range of motion method to evaluate the spine for impairment rating. And they wanted to send this injured employee out for additional testing. And that testing was conducted on February 4th. So the from date is the date of the examination, January 15th. The to date is the date that the testing was completed, which was February the 4th. And keep in mind, this is not when you got the report. Your 95 days begins on the date that the test was completed, which was February the 4th. So maximum medical improvement is for one of those complex diagnoses, right? The spinal injury. That should have raised a flag for you. So you're going to bill at 99456 W5, and you're going to add that modifier 25 for reimbursement of that specialty fee. So that's $465 plus $311. And again, the specialty fee that's required is because of that complex condition. So the impairment rating is going to be modifier W5, $385 reimbursement for that one body area. 99456 W6 is going to be reimbursed at $664. W8 for the return to work exam, reimbursed at $664 for a total of $2,502. And this is what it would look like on the bill. The from date is the date of the DD exam. The to date is the date that the test occurred. So in this example, you conducted an exam on January the 8th of 25, and then referred the injured employee out for a neuropsych test, and that test occurred on February 19th, and that's the date of testing, and it goes into the 2 section. And this was an ongoing issue for many years, where a designated doctor had 95 days to get their bill in, but they were waiting on testing. So hopefully this helps you get your bills on time. So there again, there's that 2 date. And that's going to be your start of the 95-day deadline, the date the test was completed. So this last billing example for a designated doctor is the missed appointment fee. And the doctor is ordered to examine the injured employee with a foot and leg injury of maximal medical improvement and impairment rating. So the doctor travels to the exam site. The injured employee does not attend the properly scheduled exam. They wait for 40 minutes, and the designated doctor documents what happened. They leave, and then they're going to bill for that missed appointment. And remember, they only have to stay for 30 minutes, but in this example, they waited an extra 10. But the missed appointment is going to be billed at 99456, modifier 52, unit of 1, and the fee is going to be $104 currently. So we're going to take off our designated doctor hat, put on your RME doctor hat, those required medical exams, and keep in mind your doctor may be serving in all of these different roles. Like they may be a treating doctor to some, also certified to be a designated doctor, RME doctor, but if they're in that designated doctor role, again, look at those previous rules. So if they're an RME doctor, we're going to look at Rule 134-235. RME exams are performed in accordance with the labor code in these sections and our rules. So they're going to be in response to a request from the insurance carrier or the division. And the types of RME exams that can be done are similar to the designated doctor. So it's going to be your maximum medical improvement, impairment rating, extent of injury, disability, return to work, and other similar issues. And that last one is going to be our exception, and that's appropriateness of health care. That is special for RME doctors only. Designated doctors can't. So only RME doctors that are certified to calculate an impairment can take RME exams. And again, it's billed like designated doctors with some exceptions. And remember our definitions, authorized and certified, we're using those words interchangeably. So the exceptions are that they're not going to be using those W5 through W9 modifiers. Do not use the DD modifiers. RMEs have some strict CPT codes and very little modifiers, so there's no extra reimbursement if they get assigned one of those injured employees that has a complex diagnosis listed in 127-130, like the designated doctors do. And there's no extra payment if they conduct multiple impairment ratings, and the MI modifier for multiple impairment ratings should not be used. So that's only for DesDoc billing. And if the carrier asks for multiple impairments, they can, and no missed appointment fees for RME doctors, so they don't have to bill with the assignment number either, because the assignment number, again, only for designated doctors, and the testing that the designated doctor may order. So now we're going to go through each scenario, just like we did with the designated doctor for our RME examinations. And if they examine an injured employee and they determine that they're not at MMI, they're going to bill 99456 with that NM modifier, and they're going to get $465. And this example is where the RME doctor determines they are at MMI with no impairment. The RME doctor, again, billing only for that MMI exam, 99456 with $465 for reimbursement. And this example is where the RME doctor determines that someone is at MMI and they conduct an impairment rating examination. So they go through the calculations. Even if it turns out to be 0, that's a calculation. The impairment rating has occurred. The impairment rating exam has occurred. So the RME doctor must bill $99456 and be reimbursed $465 for the MMI portion, and then they bill for the impairment rating. If it's an MSK body area, they're going to use 99456. The units are going to reflect the number of MSK body areas up to 3, and the first body area is at 398. Each additional, again, up to 2 more is going to be $199 a piece. So this is for MSK body areas, whether or not they're using the range of motion or the DRE models to calculate permanent impairment. And the first body area is currently 398, and the second body area is 199. So for non-MSK body areas found in the AMA guides, there's no limit on units. So again, non-MSK. We're going to be reimbursed $199 for each of those areas using that 99456 CPT code. And if you're going to conduct testing as an RME doctor that is not outlined in the AMA guides, you'll bill the appropriate CPT code for that test, and you're going to get reimbursed according to the applicable fee guidelines, in addition to the MMI exam portion and the impairment rating portion. So remember, if it is called for in the AMA guides, that's going to be included in your previous MAR. These are only for those outlined, not outlined in the AMA guides. For the extent of injury exam conducted by an RME doctor who's giving their opinion on extent of injury, they're going to bill 99456 with no modifiers, and 664 is the MAR and what you should charge and what you should get reimbursed. So take a note here. Your documentation is going to need to support the examination that you conducted where you're billing any CPT code. So your documentation needs to outline what you did. So check out our bootcamp presentation about medical documentation. It's going to be on our DWC healthcare provider webpage in the training section. Great webinar to help you with your medical documentation and what you need to support your bill. Also, if your RME doctor is conducting a return to work evaluation, again, 99456, the reimbursement is 664, and you are not going to bill separately for that work status report. This is a return to work exam, so that work status report form 73 is going to be included in that bill. So 664 is all that you would bill for return to work. Other similar issues is going to be the same thing. 99456, $664 reimbursement. So make sure that your documentation is clear so the disputed issues can be resolved with your opinion. And if you're asked to do an appropriateness of care examination by the carrier, you would bill 99456 with $664 reimbursement. If your RME doctor decides that they have to send the injured employee out for testing, for instance, functional capacity evaluation, FCE, or something else for a return to work exam, you can do that. But remember, it doesn't have the protections of Rule 127.10 like the designated doctor situation did. So that testing, the evaluation healthcare provider must bill the appropriate CPT codes for that test. They need to attach their required documentation. That's going to include your referral. And then reimbursement is going to be according to the DWC medical fee guideline. The carriers can review for all their defenses like compensability, medical necessity, and the assignment number doesn't need to be on there because that's for designated doctors only. Let's look at some examples. So if you're still carrying these slides around in 2026 or beyond, know that these amounts can change according to the MEI. So again, these fees that are listed are for 2025. That's our current value. So this is an injured employee with a lumbar sprain strain for MMI-IR and extent of injury and return to work. So your first line is going to be MMI 99456 and $465 impairment rating. For the one body area, it's going to be 398, and extent of injury is 664, return to work is 664, and you could bill this all on one line if you would like to, because the rule doesn't say. But again, remember, like we talked about earlier, best practices, less problems. If everything you did on the exam is itemized, and this exam would get a total of 2,191. So example 2, this is an injured employee with a lumbar sprain strain, and the RME doctor has been asked to do MMI impairment rating, extent of injury, and a return to work exam. And this RME doctor uses range of motion method to assign or assess the impairment rating, and it provide a total of 2 calculations in the impairment ratings. So MMI is billed at $99456, $465 reimbursement, and the impairment rating for one body area is $398. The multiple impairment ratings, you don't get reimbursed for that as an RME doctor the way that designated doctors do. So there's no extra lines for multiple impairment rating calculation. The extent of injury is going to be billed at $99456 with $664, and then return to work $99456 at $664. Total for this bill, $2,191. And this one is where the RME doctor evaluates the patient. The patient is not an MMI. You should only bill $99456 and M $465 fee, and that's whether they are at maximum medical improvement or not. Example 4, this is a lumbar sprain strain with a lower leg injury for the issues of MMI, IR, and extent of injury. The RME doctor uses range of motion to assess the impairment rating in both body areas, in the spine and the lower extremity. So MMI, same thing for $465 reimbursement for that impairment rating. And then there's 2 body areas here, the spine and the lower leg. So you're going to put 2 units in, the $597 fee broken down to $398 for the first body area, $199 for the second one, and then the last 2, that extent of injury and return to work evaluations, are going to get $664 reimbursement for a total of $2,390 for this bill. So now we are going to take off our RME hat and put on our treating doctor hats. And if you're in the treating doctor role, remember that the rules that apply to you are going to be 134-250. It's going to specifically address your maximum medical improvement and impairment rating evaluations. A treating doctor must be authorized to conduct maximum medical improvement and impairment rating. A treating doctor who is not authorized for impairment rating can do an exam for MMI only if there is no possibility of impairment. Again, these are going to be for those injuries that are very minor and the injured employee has reached maximum medical improvement without any permanent impairment resulting from the injury. And you can't use the AMA guides to permanent impairment unless you are certified to conduct an impairment rating exam. Keep that in mind. So this scenario is similar to the other doctor rules when your patient is not at MMI. So you conducted the exam, you're going to bill 99455, and then you're going to choose the level of evaluation and management for that visit. And so we're going to use the V3, V4, or V5, and that's going to be based on the time needed for that exam or the medical level of medical decision making. If your treating doctor evaluates the patient and they are at MMI with no possibility of impairment, and that is the treating doctor's role to decide whether there's a possibility of impairment or not, the treating doctor determines they are at MMI with no possibility of impairment. They're going to bill 99455 with the appropriate V code and be reimbursed according to the medical fee guideline for that corresponding office visit. And a note, the rounding that we've seen in the other examples does not occur here for our treating doctors. So when a treating doctor determines that someone is at maximum medical improvement and they are certified to do impairment ratings, they must bill for MMI and the impairment rating. So starting with the MMI, first it's 99455 with the appropriate modifier V3, 4, or 5, and reimbursements must be according to the medical fee guideline. And then you bill for the impairment rating portion. And remember, you have to be certified to calculate this for an impairment rating evaluation involving the MSK. I'm sorry. You must be certified to calculate this for an impairment rating examination involving those MSK areas. So you're going to bill 99455. So your units reflect the number of body areas up to 3. So it's 398 for the first MSK area and 199 for the others. And these are not subject to discounts. So here's the full MAR amounts with the maximum of 3 MSK body areas. And when a treating doctor performs an impairment rating, each non-MSK area, you can find those non-MSK body areas chapters in the AMA guides. Currently the 4th edition, 99455. You're going to get those units for the number of non-MSK areas from the guides. And those will be reimbursed at $199 each. And remember, if the testing is outlined in the AMA guides as part of the exam, you don't get extra reimbursement. But if it is not included in the AMA guidelines for permanent evaluation of permanent impairment, and the treating doctor decides that there needs to be some of these tests, you're going to bill for that, and the treating doctor conducts the tests themselves. You're going to bill using the appropriate CPT code for those tests. And then again, the reimbursement is going to be according to the applicable fee guidelines, in addition to that impairment rating exam and the MMI exam. So treating doctors, this is unique to you because you are in charge of coordinating all of the care for the injured employee. And you may receive a DWC 69 form, which is from another doctor certifying MMI and assigning an impairment rating. So you're going to review it and agree or disagree. And for the review of this report and certification, you can bill 99455 with the VR modifier, and you'll get reimbursed $66 for your work. And remember, that asterisk is there because even this fee can be adjusted by the MEI each January. So let's take a look at some billing examples. This first one is when you've examined an injured employee, a non-network injury, and the location is in Austin, Texas. And this matters because we're using the medical fee guideline here with the lumbar sprain strain and a complexity associated to the CPT code 99213. The treating doctor determines the injured employee has reached the MMI date, but there's no permanent impairment. There's no possibility of permanent impairment. So they're going to bill that 99455 V3 because that's going to be related to that 99213 CPT code. So you would go out and calculate how much somebody gets paid for 99213 on Novitas or however you're calculating your reimbursement in your area. And this example was calculated using the Austin area. So remember, rounding does not apply to MMI, this type of exam. This is a non-network claim, but if it was a network claim, then you would get your network contracted amount. So in this example, your reimbursement is approximately 217% of what Medicare pays for 99213 in Austin. For a non-network injury for a treating doctor who is authorized and fully certified to conduct both maximum medical improvement and impairment ratings. So we have another webinar, reimbursement for professional and workers' compensation specific services. That's going to specifically teach you how to calculate reimbursement values. So take a look at that webinar on our DWC healthcare provider training page. It's very valuable. In this example, the treating doctor determines that the injured employee is at maximum medical improvement, has permanent impairment, and the authorized or certified treating doctor conducts that impairment rating examination using range of motion for that musculoskeletal body area of the spine. They're going to bill 99455 V4. And remember, the modifier is related to 99214 and the complexity or time spent for that exam. So 99455 V4, 1 unit, and I calculated this out for a non-network injury in Austin for $276.54 approximately. And the impairment rating portion of the billing would be one body area for $398. And again, that could be adjusted based on the MEI going forward. So now take off your treating doctor hat and put on our final doctor hat, the referred doctor. So referred doctors, this is for you if you are who was referred to by the treating doctor, they were not fully authorized or certified to conduct impairment ratings. So they're going to refer this out to a doctor who is and can conduct impairment ratings. And this is the referred doctor or RD. So they have their own rule 134-260, and that's again, that's a doctor that the treating doctor refers to and is authorized according to chapters 130 and rule 180.23 to conduct both MMI and impairment ratings. So let's start with each sequence. This is a referred doctor that examines the injured employee and decides that they're not at MMI, and they're going to bill 99456 NM with a reimbursement value of $465. In this case, they're not at MMI 99456, $465 for someone that has reached MMI. The referred doctor says that there's no possibility of impairment. It's sufficiently minor. So the referred doctor must bill 99456. The MMI examination is $465, and they don't need to conduct the impairment rating because there's no possibility of impairment. Now, if they do conduct the MMI evaluation and they are at maximum medical improvement and there's a possibility of permanent impairment, they're going to conduct the impairment rating. And they're going to start by billing that MMI part first with 99456, $465 for the impairment rating part on that same bill. And if they're doing MSK body areas, it's going to be 99456. and then the units will reflect the number of body areas examined. And remember, they can have up to 3 MSK body areas. So the first one is going to be reimbursed at $398. No modifiers here. Each additional MSK area up to 2 more is $199 a piece for the MSK areas. And again, look for those in your AMA guides, 4th edition currently. For each non-MSK area that you're going to bill 99456 and then the units, there's no maximum number of units there. So for each of those, you're going to get $199, and you're going to get 100% of that $199 for each of those non-MSK areas that you did the impairment rating on. So if the AMA guides call for the test that's included in your reimbursement, if it's not outlined in the AMA guides and the referred doctor is going to conduct those tests themselves, they're going to bill the appropriate CPT codes for that test and then be reimbursed according to the applicable DWC fee guidelines, in addition to the other examination costs. So let's take a look at some billing examples for our referred doctors. And the referred doctor examines and determines that the injured employee is not an MMI. You're going to bill using that NM modifier, that's for everyone, with that 99456 unit of 1 and $465. And this is an injured employee with a lumbar sprain strain, injury to the lower legs. So 2 MSK body areas for maximum medical improvement and impairment rating. The referred doctor uses range of motion to assess the impairment rating of both areas. So the MMI, $465, no modifiers, impairment rating 99456, 2 for the number of body areas in the units. And for those 2 body areas, again, just like we've seen, $398 for the first one, $199 for the second one. Total MAR for this bill, $1,062. And that is it. We have gone through all 4 doctor roles. And now let's take a look at some helpful DWC resources for you. We have a designated doctor webpage. If you go to the main TDI.texas.gov website, and you select the Workers' Compensation tab at the top, you will then see the Healthcare Provider tab near the top. So select that, and it's all up to date and has great information for designated doctors or for other certifying doctors. And we're currently working on a page for certifying doctors that should be going live soon. So if you search for C under certifying doctors in the Workers' Compensation A through Z, that's going to be especially helpful for you. So be on the lookout for announcements from the division. And this is a resource guide for designated doctors only and their testing healthcare providers. So all of these email boxes are for our doctors that have any questions or issues related to those designated doctor exams or referral testing. And feel free to reach out to any of those when you need help. So let's recap what we looked at today. We went over the rules and billing requirements for designated doctors and other certifying doctors. We went through billing instructions and examples of bills for each type of doctor, including our DDs, RMEs, treating doctors, referred doctors who do maximum medical improvement and impairment rating exams. And then last, we went over some helpful resources for you to help you as you move forward. So let's wrap up our discussion in the recovery tent with a little challenge that we have put together for you. We've put together 5 statements based on today's webinar to test how well you've absorbed the material. Number 1, fees for my certifying exams are not subject to change once per year. True or false? An awesome job, everyone. You did great. That answer is false. Those fees may adjust based on the Medicare Economic Index, and that'll be done every January. You can refer to the chart that we have with all of those workers' compensation specific services on our healthcare provider webpage. The medical fee guideline page. Let's see, statement 2. As a designated doctor, I do not need to put the assignment number on my bills. Again, everyone pretty much answered that correctly, and that is false. You do, as a designated doctor, you do need that assignment number. It is super important to flag to the insurance carrier that this is related to a designated doctor exam. And also you want to provide that number to anyone that you have referred out for additional testing or additional evaluation. Question 3, or statement 3. I received a request from the designated doctor to conduct testing. I need to put the DD exam assignment number on my bill. And we did have a few that missed this, but again, this is true, like we just said. Anyone that has anything to do with that DD exam, you need to refer to that assignment number and put it on your bill in the correct place, so you'll have no problems with your bill. Statement 4. As an RME doctor, I can bill a missed appointment fee when an injured employee misses the exam. And we had some people miss this, but that is false. RME doctors cannot bill for missed appointments. Only our designated doctors. And number 5, as a referred doctor, I can bill for multiple impairment ratings requested by the treating doctor. And again, we had some miss that, but as a referred doctor, you cannot bill for multiple impairment ratings. You can do them, but whether or not you're going to get paid for them is something that's reserved only for our designated doctors. So thank you so much for participating in that little challenge that we had for you. We really appreciate your attention and for attending today's webinar. And know that always, if you have any questions after you leave here today, please reach out to Comp Connection via email or phone. We are here for you at 1-800-252-7031. Select option 3, or you can always email us any time of day at compconnection@tdi.texas.gov. Thank you so much for joining us today.